Hello, my name is Karen Moran and I'm the Head of Service Reform for Stockport CCG. As part of the Stockport Together programme, it is our ambition to reduce outpatient attendances by 55 to 60% over the next 3 years. In order to achieve this reduction, we have to look at new ways of working and how we can replace the traditional GP to hospital pathway of care. This project, the Dermatology project, it aims to redesign the traditional dermatology pathway and work towards the target to reduce outpatients through the avoidance of face-to-face appointments. The traditional pathway is that the patient will have a problem with their skin or a lesion like a rash. They will go and see their GP. The GP may or may not be sure of how to treat that condition, that complaint, or a few treatments might be tried and none of them work. So the GP would then refer the patient to the hospital to see a consultant. The patient then can wait up to 16 weeks to be seen at the hospital, and that can be a very anxious time for patients. So under the new system, the patient attends the GP practice and the GP is able to send an image of the patient's complaint to the hospital by using the new system. So the GP will have an app on their phone that they have downloaded, and that app enables the GP to take a photograph of the rash or the lesion. The GP then points their phone at their computer screen, and the referral that's been generated on the screen as part of the new system will link to the photograph on the phone and pull the photograph out of the phone and onto the referral system. At no stage is the image stored on the GP's phone. The image is then attached to the referral that the GP has made on the computer, and that referral is then emailed to the consultant at the receiving hospital. The consultant receives an email to show that a referral has been received from a GP. The consultant then looks at the image and the information that they've received, and they can make one of a few decisions. They can write back to the GP and say, actually, I need some more images or some more information, please, to make a clinical decision. They can decide that the patient does need to be seen physically in the hospital and invite them in for an outpatient appointment. They can decide that the referral is actually an urgent referral and that patient needs to be seen very quickly, or they can send advice and guidance back to the GP so that patient can be managed in the primary care setting. So when the GP receives the information back from the consultant, this is usually within about 2 days, the GP can then contact the patient and arrange the next steps of that patient's pathway to be dealt with. This is all done within a few days. The system is clinically driven and approved. It's completely IG compliant. No images are stored on the GP's phone, so it's very secure. It directly integrates with NHS IT systems already in place, such as Docman and EMIS. It's a quick and simple process. It can support onward referrals to other services. It's simple, practical, quick and secure.
Okay, I think it's a wonderful system, especially as a GP, because there are situations where I'm not really sure what the dermatological diagnosis is. Other scenarios where I have a diagnosis but I've tried a few treatments and it's not working. And now in the old system that would mean referring to outpatient clinics. This way I can get an image sent off, and usually within a day or two I get a response from a consultant dermatologist, which would either be try something different, or in some cases it's actually refer to the outpatient clinic. In my experience, it has stopped referrals going on to outpatient departments, which is great for me. It's great for our patients as well. It means they're not having to wait several months for an appointment and then the hassle of going to a hospital. So it's working really well.
So from the secondary care point of view, the system is very easy to use. You receive an email alerting you when the new referral has come, which is great because it means that you can respond in a timely manner to the GP and the patient. And we've also found that we have been able to avoid a number of referrals into secondary care by providing advice through the dermatology system. We've also found that it's been a nice way of interacting with our GP colleagues, and we've received positive feedback from them in terms of the educational aspect of the information that we're able to provide them as well. And in the longer term, hopefully it will allow patients to be dealt with more promptly and avoid unnecessary visits to hospital for patients that can be managed in primary care.
When you consider in this modern world that we send emails which land on our desks within minutes, we take photographs, and the same happens, you can send them to anybody, anywhere in the world, and everything that's going on computers, it really is a no-brainer. The idea is fantastic, and I would recommend it to anybody.
The next step of this project is to roll the software out to all Stockport GPs. This will enable all Stockport patients to be able to benefit from this pathway of care. That will also help us understand the number of cases that this pathway can be used for rather than the traditional outpatient appointment at the hospital. It's then our ambition to enable all GM-wide GPs to be able to use this software. That will mean that any patient living in Greater Manchester will benefit from the opportunity of getting a consultant dermatologist's opinion without having to travel further than their own GP practice.